What are the risks of lip fillers?
Fear of overinflated and unnatural looking lips can keep a lot of people from having lip fillers. As is the case with any cosmetic filler treatment, results are dependent on the doctor and the patient's aesthetic goals. Achieving this goal requires skill and experience as far as technique is concerned, as well as knowledge and experience with the specific filler being used. I'll discuss some risks associated with lip filler treatment and how these risks can be minimized so you can achieve the results you want safely. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I spend every day in my practice helping people with their facial appearance. I routinely perform surgical procedures such as cosmetic eyelid surgery and facelifts. I also specialize in non-surgical cosmetic procedures which are enhanced by my knowledge and experience as a surgeon. With this perspective, I help my patients with a range of fillers for volume deficiencies related to factors such as genetics and aging. The biggest concern for people considering lip filler treatment is the risk of having conspicuously bad results. Patients often cite a certain person or celebrity who has, as they describe, huge lips caused by fillers, applying the term duck lips as the descriptor. They often say if this celebrity has so much money and they can afford the best, how did they end up looking like that? The answer, in my opinion, is a combination of factors. The first is the shared vision between the doctor and the celebrity. It is not unusual in this field for a particular type of doctor and patient who share a perception of exaggerated features as being desirable. At the same time, some people really feel that their lips should look in a way which most people would perceive as being too large or disproportionate. These individuals are committed to finding the practitioners who are willing to help them achieve their ideal vision. This overfilling or overuse of fillers is not my aesthetic. My vision, which I share with my patients, is to achieve harmony so the facial features look natural and the patients don't appear as if they had a procedure done. This natural aesthetic is a way of achieving enhancement while maintaining the character of the person I'm helping. With the growing popularity of fillers and a wide range of physicians and non-physicians performing these procedures, an increasing number of avoidable complications are being reported. It is important to understand that minimally invasive is still invasive. Once you go through the skin, the risks of complications are comparable to the risks of surgery. This raises the question about the level of expertise of the person performing the treatment has if a complication were to occur. When a complication occurs, timing of intervention by an expert who is a physician can be critical. That being said, the art of lip filler placement in my hands begins with taking photos and reviewing with my patient the details I see on the photo so that we both agree on the areas for enhancement. I then plan on minimizing the number of points of placement to maximize my patient's comfort. I use blunt cannulas and anesthetics in a way which minimizes trauma and maximizes comfort. My patients rarely have any bruising and have minimal swelling. When it comes to lip volume, I'm conservative with the volume of filler I place so lips look fuller and take on a shape consistent with the other facial features. I see my patients after 2 weeks to see how the filler has actually settled, and we decide together if additional filler is appropriate. I feel that hyaluronic acid fillers are the safest and ideal choice for lip fillers. I routinely use Restylane L, Restylane Silk, Juvederm Ultra XC, and Juvederm Volbella for lip enhancement. These are all softer fillers which integrate well with the lips, resulting in the ease of movement related to speech, expression, eating, kissing. Softer hyaluronic acid fillers last about 6 months to a year and are gradually and safely metabolized by the body. Since hyaluronic acid occurs naturally in the body, these fillers are tolerated well by the majority of patients. An advantage with hyaluronic acid fillers is that should an undesirable outcome occur, I can dissolve the hyaluronic acid filler with an enzyme called hyaluronidase. This characteristic is in line with my preference for any procedure where I strive for maximal safety, predictability, reversibility when possible, and minimal discomfort and downtime. This is in contrast with permanent or semi-permanent fillers, which can be associated with much more serious complications. Complications such as nodules and infections can require surgical removal and can be disfiguring. One of the most serious risks of lip filler injection is vascular occlusion, where the filler is injected directly into a vessel, which then blocks a network of vessels which are critical for blood supply to sections of the lip. This can be disastrous as pain and loss of lip tissue can occur very quickly. Again, the popularity of fillers creates a perception that these procedures are without risk. The question that should always be asked, like being on a plane, what happens if something goes wrong? Is this the most qualified practitioner when something doesn't go as planned? I often hear from my patients that they are hesitant to try having a lip filler placed since they have a friend or who experienced extensive bruising and swelling, which prevented them from seeing people and even going to work for several days. Bruising occurs when a needle pierces a blood vessel. Doctors or practitioners who enhance lips by performing multiple needle punctures often create several bruises. In addition, multiple entries of the needle through the lips may cause bumps at the entry points of the needle in addition to the bruises. I routinely use blunt cannulas for placing lip fillers, which significantly reduces the trauma to the tissue and the vessels, making bruising actually a rare event. I also minimize the entry points so that my patients experience minimal discomfort and minimal swelling. Like any cosmetic medical procedure, there are potential risks as soon as the skin is penetrated by an instrument, including needles and cannulas. However, risks for any procedure are reduced by the knowledge, experience, and techniques used by the doctor. I apply the standards to my patients that I would apply to any physician who would care for any member of my family or myself. By minimizing risk with optimal techniques, you are more likely to have the results you want and have a positive experience. I hope you found this information helpful. Thank you for your question.